Good afternoon, everyone. It's a pleasure to be part of this panel, and congratulations to all of you on the launch of our first international UCA chapter and conference. I'm so sorry that my schedule did not allow me to join you in person. Urgent care began in the United States in the late 1980s by a few individual physicians recognizing the need for access to walk-in care in their own cities that didn't need to be in the emergency room. It was urgent, but not emergent. The growth here was very slow at that time and very disorganized. The Urgent Care Association wasn't even founded until late 2004 by urgent care leaders who were beginning to recognize the emerging importance of urgent care. They also recognized that urgent care would become more and more important over time as healthcare delivery evolved and patients came to expect walk-in access to non-emergency care. And they were right. As of today, there are 14,418 urgent care centers in North America. UCA's 20th anniversary is coming up. Over the past 20 years, we have served as the primary source for education on how to plan for, build, open, and successfully run an urgent care center. We've become the gold standard for best practices in providing care in an urgent care center and in urgent care center management. And we've become a place where like-minded professionals can come together and share stories and solutions and just be part of a community. We are very excited to have the new members in your countries become part of what we are doing together. We're committed to ensuring that urgent care gets better and better over time, and that urgent care as a healthcare business can stay successful in the long term. We also have two sister organizations that play important roles. The first is the College of Urgent Care Medicine, which oversees and directs all of the clinician-related activities. When you or your organization become a member of UCA and a member of the Egypt-MENA chapter, if you're a clinician, you're automatically granted membership into the College of Urgent Care Medicine. And I'll talk a little bit more about the benefits of that in just a moment. We also have a foundation that provides funding for original research in urgent care. There is not very much original research, particularly clinical research, in the urgent care setting. And so as urgent care develops in your countries, we'd welcome applications for original research grants, especially in clinical outcomes. As a member of UCA, you have the benefit of our knowledge for more than 20 years of experience doing urgent care. And there are a few different ways that you can take advantage of these resources. The first is in our Learning Center, and I want to show that to you now. Okay, hopefully you can see that. On our website, which is urgentcareassociation.org, you will see a section for resources. Under those under those resources, if you don't click too fast, is the Learning Center. You can see there's multiple ways to get there. There are many programs in the Learning Center that you will want to take advantage of, from training your staff to yourself. But I want to show you today the kind of content that's in there. There's, as you saw in the resources section in general, there's clinical education and other kind of trending topics, but I want to focus on the Learning Center in this session. You will see that we have content in both operational or administrative areas as well as clinical. So let's take an example and see what we see in, let's say, radiology. What you see here are 5 lectures on radiology and urgent care. 2 are clinical and 3 are administrative. And so those are an assortment of things just on radiology. There's going to be more than that. Those are just the top 5 that I always show. Let's take a look at starting a new urgent care. Here we find a couple of resources on billing and coding, a resource on how to set up your clinic, from picking out furniture and equipment lists and those kind of things. We see something on how to train clinicians as well as how to grow your volume. So I just wanted to show you a couple of examples so you can see that this Learning Center should be a great resource for you. The other one I want to share is our listserv. But first, I will tell you about a couple of the benefits that you get directly that you don't even need to come to the website for. You'll receive digital copies of our Journal of Urgent Care Medicine. That's our monthly magazine that has both clinical and administrative articles in it. And then all of the clinicians that are part of your centers will receive another magazine quarterly from the College of Urgent Care Medicine that's called Urgent Caring. You can also search back issues of both of these publications to find pretty much anything to do with excellence in urgent care. So the last resource I wanted to mention and show you is our listserv. This is, I'm going to show you what it looks like to get to the subscription. This is an email listserv where our members ask each other questions about how they are doing things in their center, and it is a great resource for sharing information. This is just the sign up screen, as you can see, and there are a couple of different listservs that we have. One is general for all topics, and then one is specific to urgent care medicine. To get to this sign up screen, you can just go to our member benefits section, or you can just type in the URL that's up here. So I'll leave that up for just a moment. And these are just a couple of the resources that we've put together over the past 10 to 20 years that are free to all of our members. And so there are a couple more that I want to show you that are going to be important when you're thinking about how to set up a new center and what services you want to offer. So I'm going to leave this screen up and show you in our quality section. The first one we're going to start with is certification. A certified urgent care provides a certain scope of services that are defined by this program. It's very important as you start to grow urgent care in your regions that patients understand the services that you offer. This is a battle that we've had to fight in America that I would love to save you from having to do, which is why we created certification. There are different types of certifications, and there's information on all of these, very fine details on the criteria for those. And I recommend reviewing the criteria as you are planning what to offer in your centers and how to set them up, particularly if you plan to offer services to tourists from the US. And I know that you all are talking about that later today. They will have certain expectations if they see urgent care in your name. You can certify a center even before you open it by simply applying and attesting to meeting the criteria. Most of you will be choosing comprehensive, I believe, and then providing photographs and some other documentation to support your application. It's very, very easy and inexpensive. The next level of achievement is accreditation. And that is also in the quality section of our website. These criteria are much more extensive and are essentially standards for quality in urgent care centers. And though accreditation is not yet available in your areas, we are committed to working with your leaders, such as Dr. Ahmed, to create these programs as soon as possible. We are very pleased to see urgent care beginning to grow across the world. And I believe that though we're on different sides of the globes, our issues are very similar. Just in talking with your leaders as we've been developing the chapter, there are many, many parallels. And so we will learn together as urgent care grows in your region. We look forward to sharing our expertise that we have gained over long, hard 20 years and hope that we'll be able to help you all skip some of the challenges that we had to face, both very big and comprehensive and very, very small. I want to thank you again for letting me participate in the conference remotely. I want to congratulate everybody on the achievement of launching the chapter and your very first conference. And next time, I hope to be there in person. Thank you and have a great rest of your evening and conference.